Hello everybody, welcome to the second part of our module. Let's make anatomy simple. Now let's learn how to describe an organ or a body part in anatomy. What are the words used to describe it? Yeah, it's here. The front surface of the body is referred to as the anterior or the ventral surface, whereas the back surface of the body is referred as posterior or dorsal surface. The lower portion of the body is referred as inferior or caudal surface, whereas the upper as superior or cranial surface. Now, let's imagine a person standing in anatomical position. The red line in the middle indicates the mid-sagittal plane or the median plane. Okay. Now, this blue line here, this blue line is near the mid-sagittal plane. So, it is referred as the medial border of the hand. Whereas the green line, this green line is referred as lateral border of the hand because it is away from the mid-sagittal plane. My dear students, the important point to be noted here is all these references, medial border and lateral border, are referred with respect to the median plane when when the patient or the subject is standing in anatomical position. That is very important. And now it's the activity time. Yeah, my dear students, just fill in the blanks. Number one, Rajasthan is dash to Delhi. Number two, Karnataka is dash from Delhi. The options are in proximity and at a distance. So you very well know that Rajasthan is very close to Delhi and Karnataka is away from Delhi. That is at a distance from Delhi. So the answer is Karnataka is at a distance from Delhi and Rajasthan is in proximity to the Delhi. So my dear students, proxy refers to near. Dist, the word dist refers to away. So see here what you understand. Yes, proximity is near, distance is far. In anatomy, proximal refers to near from the head end of the body. Sometimes proximal also refers to near the joint. I will explain it in the coming slides. Distal is far from the head end of the body. So, here is another activity, and I hope everybody will get the answer correct. Shoulder is dash to the head, fingers of the hand are dash to the head. Shoulder is, yes, shoulder is proximal to the head. Shoulder is near the head, so it is proximal. Fingers are away from the head, so it is distal. My dear students, you must also note that head is not the only reference point. This upper limb joint and lower limb joint can also be used as a reference point in relation to proximal and distal. So, this diagram is given in such a way that any structure which is near the joint is referred to as proximal and away from the joint is called as distal. Similarly, in the lower limb, any structures near the pelvic bone is referred to as proximal and away from it is called as distal. So, the next aspect of describing the body structure, how deep a structure is inside, how superficial it's outside. Here is the activity. The skin is dashed to the skull bone, whereas the pituitary gland is dashed to the brain. Where is the skin? Of course, skin is the outermost covering of the body. So, the skin is superficial to the skull bone, whereas pituitary gland is very deep inside the brain. So, inside is referred to as deep. That's about superficial and deep. Here is a schematic diagram to represent which is superficial and which is deep. Okay, you may be hearing these words in the cross section of neck as superficial fascia, deep fascia. Okay, now it's the Kotti story time. So, what is the story here? A person is walking in the road, that too in the middle of the road. So, he meets up with an accident, got injured, and injury is in the head and in the right side of the head actually. Okay, he is admitted in the hospital and reports have come. Doctor is saying his left limbs were paralyzed due to right side brain damage. How come? Yes, if right side of the head is damaged, it is natural that left limb would be paralyzed in most of the cases. So there comes the terminology of laterality. Right side brain injury cause paralysis of which limbs? Opposite side limbs. Opposite is meant in anatomy as contralateral. So, what do we use for the same side? Ipsi. Ipsi means same, contra means opposite. That is a very familiar thing which we must know to address in terms of laterality. So, unilateral refers to one side, bilateral refers to two sides, contralateral refers to the opposite side of the body, whereas ipsilateral refers to the same side of the body. So, my dear students, gear up. Let's learn the terms used for movements in anatomy. That is, the terms related to body movements. There are many terms in this context. Maybe it is flexion or extension, or circumduction, abduction or adduction. It may be a supination or pronation, or elevation or depression. But as an exam going BDS student, you must very well know that elevation, depression, and abduction and adduction are the most important terms, and there must not be any mistake related to it. So let's concentrate in these terms. Okay, kidnapping is the most famous vehicle used for kidnapping, and the word kidnap also has another equivalent word called abduct. That word abduct means take away. So if you just go into the etymology of that word, you can see the ab meaning away from, duct is carrying, and ion suffix is process of. So the word abduction means process of carrying away from the midline. So anything or any body structure, if it is taken away from the midline, it is called as abduction. Okay, are you clear with the meaning and the split ups? So, what is this Feviquick? What is that? It is an adhesive. What is adh? Adh refers to bringing two surfaces together. The process of bringing two surfaces together is called as adhesion. So here ad refers to toward, duct refers to carrying, and this suffix ion is meaning as process of. Adduction is the process of carrying towards the midline. So if any body structure is carried towards the midline, it is called as adduction. Okay, so this is related to your upper limb, lower limb, etc. But as a dentist, as a dental student, we are more concerned about the TMJ movements. So here, when the patient opens the mouth, actually what is happening? This mandible, this entire mandible is coming downwards. So when the patient opens the mouth, the mandible moves downwards, and that action is referred as depression of the mandible. The main MCQ here is which muscle is responsible for depression of mandible or opening the mouth? That is the lateral pterygoid muscle. This is a very important point which you must definitely know. It is a Viva question also. So, the next question which you may get is which muscles are responsible for closing the mouth or elevation of the mandible? Actually, what happens? The mandible is moving upwards. So, the muscles responsible for upward movement of the mandible are masseter, medial pterygoid, and temporalis. Yes. So, here you must not be confused with the terms elevation and depression. That is the main meaning of these slides. Elevation of the mandible is moving upwards, that is nothing but closing the mouth, whereas depression is opening the mouth. Lateral pterygoid is responsible for depression, and other three, masseter, medial pterygoid, and temporalis, are responsible for elevation. So be clear with this concept. You must not get confused with this concept. Okay. So the next two movements in relation to TMJ are protrusion, that is sliding the entire mandible forwards. Okay. And the next one is retrusion. In retrusion, the lower jaw goes backwards. That is simple. So here we have touched the important movements related to our body and related to our TMJ. There are many other movements which will be done in a separate video. This is of exam point of view. In the next part, we will discuss some important aspects in bones. What are the terminology used in bones? How to describe a bone in osteology will be in the upcoming video. Thank you. Bye.